Hey everybody, welcome back to the ECG channel. My name is Reid. If you enjoy this content, please subscribe. You can continue watching my daily reviews. So let's get into it. So this is a great EKG example of how to use context clues to decipher this funky rhythm that we'll just take a look and we'll talk through it. So first thing here is we've got our first 3 lines of the 12 leads, and then we have rhythm strips for V1, lead 2, and V5 here at the bottom. Those are common leads that we have a full rhythm strip for at the bottom. And so if I start off, say, at V5, and I look and scan through, I see I've got this irregular rhythm. I've got somewhat of a narrow-ish, maybe it's actually quite wide, QRS, and then I've got these 3 beats in a row, and then I've got a longer couple beats, and then a 3 beats in a row, and then a random beat, and then 3 beats again. So it's an irregular rhythm. I'm not so sure I see a perfect pattern to it, but maybe you could say there's some groups of 3, and then 3 and 3, so there's maybe a pattern to this. And my QRSs look the same in V5 here at the bottom, but what I urge you to do is when you see rhythms like this that are just looking bizarre, right? You're looking like, let's look through some other leads, and I look here at lead 2, and I see I've got beat, beat, and then that quick beat, it actually looks a lot different in this rhythm. And I've got beat again, beat again, beat again, funky rhythm, 1, 2, 3, funky. So this actually gives us a lot better of an idea on what is going on, because as you notice, I've got 1, 2, funky beat, and then from here on we have 3 normal beats and a funky beat. I urge you to compare QRSs to QRSs. And so remember, depending on the lead that you're looking at, these funky beats, like in V1, this is the funky beat. It looks very similar to its sister QRSs to its right and left. But if you continue to go up and you look, you can see it's funky in this beat. It's funky in this beat. If you go over to this one here and you look up, you can continue to compare all of these beats to each other and maybe help understand what it is. And so let's dive a little bit deeper into this rhythm. So for our baseline rhythm, I want to know what is going on, what is driving this rhythm. And I do notice here, if I go back to lead 2, I do notice that there's a little P wave that appears to be before this QRS. This is that P wave. And it do seem that this is another P wave going to this QRS. And then we've got the same QRS here. We've got P wave to QRS, P wave to QRS. And so because I'm trying to figure out what's going on, I'm actually going to go ahead and identify this early beat. So this is obviously a premature beat. And it is a wide, complex QRS, this premature beat. And in front of it, I don't see any P waves. So I don't see any P waves. So a wide, complex beat in the setting of no P waves, that has to be a premature ventricular complex, a PVC. And we can take a quick glance at the rest of these and note the same thing. This is a PVC, PVC. And if you notice, the PVCs are occurring every fourth. So the PVCs are occurring every fourth beat, which we term quadrigeminy, or in this case, ventricular quadrigeminy. And so I see I got these PVCs that we noted every fourth beat. And now that we've teased out those PVCs, what is going on with our actual baseline rhythm? And I'm still going to be looking at this lead 2 rhythm strip here at the bottom of our screen. And I want you to, first let's take a look at our rate of our normal beats. And so our normal rate here, if I take a QRS that's about on a solid line, we'll call this one, and I count, I get 300, 150, 100, 75, roughly 60 beats per minute. Okay, that's my QRS rate. I said that I've got these P waves that appear to be conducting to the QRSs. And so when I look at the atrial activity, now we're going to start going through our algorithm here. When I go through my atrial activity, I said those are P waves. There's a P waves in lead 1, or upright in lead 1, and they're upright in AVF. That means they're going down to the left. This is my sinus P waves. This is the sinus rhythm. My AV node is the next in the conduction system, so I'm going to measure my PR interval. And so if I look, say, here at lead, let's choose lead 3. My beginning of my QRS is right there. Beginning of my P wave is right there. And I see that my PR interval is roughly 8 small boxes, or 8 millimeters, which each little box is 40 milliseconds, so that's 320 milliseconds. So that's long. So we've got an AV block. And now we need to figure out what type of AV block is this, right? We said we have some group beating down here. We've attributed that to these premature ventricular complexes. But is this a first degree AV block? Is it a second degree AV block? And so now we really have to dive into finding our P's correlated into our QRSs. And what I want you to notice is if I go back down to my lead 2 rhythm strip, we've got this rate that's 60 beats per minute of our normal QRSs. And if you notice, this next normal QRS lands right on time. And they keep landing on time perfectly as they march down. And if you erased these QRS from the PVCs, this rhythm would look awfully regular. And so that is something that I think is really helping me help determine what this rhythm is, because if I zoom in, what I notice is I've got P, we'll zoom in right here, P that conducts this QRS. My next P here conducts this QRS. And so these P's are occurring at roughly 60 beats per minute. And my next P, I would expect to occur right here if I counted my rate, right? Because that next P would need to occur 300, 150, 100, 75, 60. It would need to occur right around here. And take a look at the T wave of that premature ventricular contraction. Usually PVCs, they have this slurry wave, and then they've got this down-sloping ST segment. But look how notched this is. And what you can actually notice is, our normal P waves, if you look at our normal P waves, like right here, and this lead are kind of little notchy P waves. Well, look what I see superimposed on the T wave of this PVC. I see this superimposed notchy P wave that occurs right on time. And this is the P wave that is conducting to that QRS. And then I've got my P to my QRS. I've got P QRS. And then I've got this PVC here, but buried in that T wave is the next P that's conducting to this QRS. And so what we're seeing is an underlying sinus rhythm with a first degree AV block because every single P wave is conducting to QRSs. They're just taking a prolonged amount of time. And we're having these superimposed PVCs that are occurring right when our P waves are happening as well. So remember, a premature ventricular contraction depolarizes the ventricles, so we can still have atrial contraction. So we've figured that out. Now we need to go to our QRS complex. We said our QRS complex is wide. If I check out up here, maybe in lead 1, the duration, maybe it's 180 milliseconds. So that's wide. We know that wide QRSs often occur from some type of conduction disturbance in the His-Purkinje system. And if I look here at V1, I can see my normal QRS complexes that I've got this RS, R prime, RS, R prime, RS, R prime. In V1, I've got these slurred S waves in my lateral leads, which include V6 and V5 as well. So this is good criteria for a right bundle branch block. And the last thing I do is I scan through and I check my ST and T wave segments, and I don't see any other deep Q waves or ST changes that are concerning for ischemia in this individual. And so what is our final analysis of this rhythm? We've got sinus rhythm with a first degree AV block, a right bundle branch block, and ventricular ectopy in a quadrigeminal pattern. So I hope this helps you kind of work through this EKG. It's really difficult when you have atrial activity buried on ventricular activity, but I urge you just to continue to scan through all the leads, see how one QRS complex in one lead isn't enough. You need to get the full picture, and so scanning vertically can really help in these scenarios. So have a great day.